Okay. Okay. Let me see what time it is. I can't see that clock. Good afternoon, ladies and gentlemen. We are. Um, I have been sent an urgent missive from Dr. No. Some of you will know who that is. I've been instructed to confess to my reckless behavior yesterday, and I got a script of correction. I have to submit to begging for forgiveness, and I want to correct my erroneous statements regarding process forms as I misspoke yesterday during Health Subcommittee. Health Committee process forms must be submitted to Megan Tidrick in House Health Full Committee, not the research analyst Harris King to my right. The forms will be due the same day as all health amendments are due into Megan in Chairman Terry's office by email, which is the deadline is Monday at 10 a.m., just like the amendments. I want to encourage all of you to submit the process form early so committee members can be better informed and have an idea of the intent of your legislation. I want you to tell the other sponsors of bills, your friends, the lobbyists, that we need to get these in so that we'll be well informed and can take measures with your bill. So according and by instructed to Dr. No, I'll be in the hallway so you can stick splinters in my hand after the meeting. So we'll move on. We have two bills on this calendar. One is House Bill 10 by Chairman Reedy, and that has been rolled 1 week. That brings us to House Bill 13, which is by Chairman Hulsey. We have a proper motion and second on the bill. There is an amendment, but I think Chairman Hulsey wanted to discuss his bill before we get into a discussion of an amendment.
Thank you, Mr. Chairman, and I appreciate your indulgence there, and thank you, committee. If you'll indulge me for about 4 minutes, I just want to introduce my bill and what the purpose of it is. When people look at what's happened in the United States in the last 12 months, they've seen governments do things all across this country that have never, ever happened in the history of the United States. And it scares them, and they have every right to be afraid. They begin to ask questions about past viruses that have swept through the world and this country. They go back and look at the Spanish flu virus in 1912, killed 500 million people. The smallpox pandemic virus that moved through had a death rate of 80% for children and 30% for everybody else. The swine flu had a death rate of 12%. SARS had a death rate of 10%. MERS had a death rate of 36%. And we never shut down one school, shut down one business, closed one church, or told people to go home and lock themselves in their house and cower in fear. But this virus that has a death rate of 0.4%, we did all that. And people don't understand why. And it scares them. And I think they have every right to be afraid. And then they ask questions about government. Does government have a constitutional authority to limit the movement and quarantine sick people? And most constitutionalists say yes, they do. Some say no, they don't. But then the question comes, does government have the constitutional authority to limit the movement and attempt to quarantine well people? And the answer is absolutely not. That's tyranny. And it scares people. And they have every right to be afraid. People understand that there are 4 circles of domain and autonomy in this country. There's a circle of domain for an individual and his self-autonomy and his right to self-government. There's a circle in the autonomy of the family. And there's a circle in the autonomy of the church. And then there's the domain of the state. And they saw states all across this country trample over the top of other sovereignty and have their will. They saw them move into the sovereignty of a church, even though people in this state know and across the country should know that the state's not the head of the church. Christ is the head of the church. Churches have their own government. They have their own bylaws. They have their own constitutions. And all across this country, people saw the state shut doors of churches. Thank God our governor didn't do it. Some had limited. You can have 10 people in there. There'll be no hugging. There'll be no handshaking. There'll be no choir singing and no special music. And you better stand 6 feet apart and wear a cloth over your mouth. They've never seen this in the history of the United States. To be honest with you, I was disappointed that pastors and preachers and elders and deacons and priests and rabbis and bishops did not rise up collectively all over this country and say, no, we will obey God rather than men. But most acquiesced, and it scares people. And they have every right to be afraid. They understand that when public health becomes the highest law, it sets aside liberty and freedom. When public health becomes the highest law, it is all inclusive, because public health affects just about every area of your life, every man, every woman, every child in this state. It's all inclusive. And when public health becomes the highest law and liberty and freedom get set aside, then because it's all inclusive, it's unlimited, which means the state's unlimited. And the state holds hands with the medical community, and they are unlimited in their influence and what they deal with every man, every woman, every child in this state. When they're unlimited, that means the only competency rests in the state and the medical community. All the masses are incompetent, which means all the masses are children. All children need a daddy. And the state gladly steps up, says, I'll be your daddy. It scares people. And they have every right to be afraid. So when they look down the road and they see a brand new vaccine come out in 5 months, that's never happened in the history of civilization. Nobody knows anything about it. They don't know how it works. They don't know what it does. I have 5 medical doctor friends that I correspond with just about every week. These 5 doctors say that it's a misnomer to call it a vaccine. It does not meet the definition of what Tennessee says a vaccine is. They say a more accurate term would be genetic modification or genetic therapy. But when people look down the road and see this come out in 5 months and see government push it, based on everything they have seen for the past 12 months, it scares them. And they say, when you get enough supply of this vaccine, it will not be voluntary anymore. It will be forced. And it scares them. So the purpose of this bill is trying to assuage some of that fear and try and claw back a little piece of constitutional integrity so that Tennessee people can put their head on their pillow and say, well, at least in this state, government, holding hands with police, cannot force me to take a medical procedure that I do not want. And there you have it.
Okay, thank you. And let me say first that I don't think fear of vaccines is something that showed up 12 months ago. I've been in public office for 30 years, and the first day I ever took office in 1990, there was a fearful vaccine group at that time. So this is not a new phenomena, and I would open this up for questions. Does anybody, Dr. Terry, you're recognized.
Thank you, Chairman.
Yeah.
I would like to thank the sponsor for bringing the bill. I appreciate you bringing this bill. A little background on me, and you may or may not know this. I obviously did get the vaccine back when it was in the first shot back in December. I think I may have been the first legislator that got both doses of the vaccine. And at the time, and I still believe this, is that that's a decision between you, your family, your doctor. It's not a decision that government needs to make. I mean, we had an emergency use authorization for this vaccine, and it's not completely FDA approved, and that may take years for them to get that away from the emergency use authorization. And so I completely understand those concerns. I agree with you on that. And as I've told people, a few years ago, we passed a law called the Right to Try Act. And that's how I kind of view this, the vaccines that are out there right now. You have the right to try. You have the right not to try. Mm-hmm. So I'm with you on that. I appreciate you bringing that to us. And I'm going to support your bill as is.
Thank you.
Thank you.
Leader Marsh, you're recognized.
Thank you, Mr. Chairman. And I agree with Chairman Terry on all of this, really. My question is, I've heard a lot of people say they're scared. They don't want to be forced to take a vaccine, but I haven't heard anybody anywhere around that's saying that they're going to force anybody to take a vaccine. So I think this has just gotten a big scare tactic going that people think they're going to be mandated to. And I haven't heard anybody say with any truth at all that they're going to mandate a vaccine.
That's Chairman Halsey.
Yeah, and thank you for that. And that's why I'm saying the purpose of the bill is to try and assuage some of that fear. That's why I'm running the bill. And by the way, I'm not an anti-vaxxer. Okay, I've had several. This is not an issue of vaccine with me. This is an issue of force. Yeah. And government force. And by the way, this doesn't apply to private business. I don't think state Tennessee's Constitution allows us in the legislature to nose into private business and dictate their hiring and firing practices. This doesn't apply to private business. This is government.
And let me say we've got another question. Let me say that I've been told that federal law protects any group of employees over 15. It extends their medical and religious exemptions to employees of a business that's over 15. So you're exactly right on that. That stays in place. So this does have a different application. Dr. Kumar.
Thank you. Thank you, Chairman. I think all of us have. Oh, forgive me. Okay. Thank you for bringing this bill. All of us have great admiration for your commitment to liberty and the defense of it. We, I think, all stand with you on that. The concern I have is that it creates an anti-vaccine attitude. And I'm concerned about that because you agree that vaccines have been good for humanity and have saved lives through the centuries of all the other conditions that you did.
Again, I'm not an anti-vaxxer. Yes.
So you agree that vaccines have saved numerous lives, billions of them, and are a useful tool. I think we should be grateful that we were able to develop a vaccine at this time rather at fast speed. And I think being suspicious that this is gene therapy, no, it's modifies, it helps our genes to create antibodies against the vaccine. But I want to make sure that this is not going to alter our genes in any way. It's not a gene therapy per se. The concern I have is that I think one concern is about medical facilities requiring their employees to get vaccinated to protect them, as well as preventing those employees from bringing COVID or other diseases into their medical facility. Do you think that's justifiable for my hospital would at times require me to go get a chest x-ray or get checked for a condition to which they felt at the hospital we might have been exposed. And I think that is the way to protect people. Do you think hospitals have a duty or they should have the freedom to require employees to get vaccination or other means to protect their health and health of the patients?
Chairman Halsey.
Again, with private hospitals, I have no control over that. They can design any policy that they want to. This deals with government. Now, I did not know until the Hospital Association brought it to my attention that there are several hospitals in Tennessee that are government run, that are owned by cities like Erlanger. I did not know that. But yes, this bill would apply to a government run hospital, not a private run hospital. I do think, of course, there's a responsibility of hospitals to do all they can to keep the spread of a disease down for certain. The EEOC recommends that you don't have a forced policy with the COVID-19 vaccine. And by the way, this doesn't deal with any other vaccines, just this one. And their recommendation is that you have reasonable accommodation for these folks. And I think that's very reasonable.
Yes, Dr. Kumar.
Thank you. I think you say that you're protecting people in government-owned facilities. And I would submit to you that, of course, the lives of those people who are not in the government-owned facilities, they are equally valuable. But I think by doing this, we are setting a tone and a precedent. You say this bill applies only to COVID, but certainly down the road, if another condition comes along, this could be used as a precedent, don't you think?
Chairman Halsey.
Yeah, except, Doctor, I would probably view it the other way, is down the road, like we talked about. And that's why I'm running the bill.
Dr. Kumar.
Have we had forced vaccination, forced treatments ever in our country?
Not that I know of, except for children. And there's an exception to get out of that. We haven't had. But again, the whole focus with this bill and government is force. If we've not had it before, but we have never in the history of the United States shut down a school, a business, a church, limit the movement of people over a virus, ever. That has never happened. And so when you look at where we were and what's happened in the last 12 months, then to me, force is not out of the question at all.
Dr. Kumar.
Mr. Chairman, the fact is that today we are better informed about the spread of viruses and the public health means that could be practiced. Because we did not practice those means at that time, you gave us a list of 50 million or 100 million people dying. At this time, unfortunately, we still have 500,000 people that died in the United States, despite those measures. And I would submit to you that those measures played a role in keeping the number of those deaths to the level we are at. Things could have been much worse. It is as a public health, science has progressed, we were better informed to be able to take those measures at this time. And that's why the death toll is lower than the other conditions there has been. But let me, if you want to respond,
No,
you
that's
can.
okay. Go ahead.
But let me move on to the other concern is, what about schools? Are schools run by state government?
They
Public
are.
schools.
That is correct.
So what will happen in public schools? Children can come to that school without being vaccinated and potentially bring an illness into the school, exposing our children and the teachers. I mean, that is a very, very major thing. It is our duty to protect those children if we want them in school, which all of us do want.
Chairman Halsey.
Okay. From what I can read, the chances of a child dying from this virus is 0.0003. And I think there is there is no proof that asymptomatic people can shed this disease. There's an assumption that it happens, but there's no proof that it happens. Sick people certainly can. So it turns out that this particular virus has the highest infection rate, but the lowest death rate of any virus we've had. So again, the whole focus of the bill is based on what we've done in 12 months over that type of virus and the fear that it generates. I'm just trying to assuage it.
I would like to humbly correct the fact that yes, asymptomatic spread is very common. In fact, in certain studies, 60% of the spread happened from asymptomatic carriers and shedders of virus. I would stand behind that statement. So coming back to it, really a death rate of 0.003% for our children, if it can be avoided, every child is precious. We really should not take that chance. And I think that is a very major flaw in this legislation that would allow our schools and our children to be at risk. I would submit to you that you will. We know you, and as much as everybody loves and respects you, we also know that you will do everything to protect every child in our schools.
Of course.
So you will not say, oh, it's only 0.003%. I don't think you really mean that sincerely. And I don't think any of us would allow that.
Chairman Halsey.
No, I was just trying to point out the numbers at where they stand. The last statistics I read from the doctors putting out those numbers, they were trying to make a correlation and show that a child has a higher propensity and risk of dying from influenza and seasonal flu than this virus. I was just trying to make the point that a virus that has the highest infectious rate but the lowest death rate has produced all this that we've done and seen in the last 12 months. And it has created a great deal of fear in people.
Dr. Kumar.
I would submit to you, Chairman Halsey, that the reason the death rate is the lowest than other viruses is because of the advances of medicine today, the ventilators and other medications and so on, and the ICU care. So I think this is a deadly virus. We were able to contain the death toll because of advanced medical advances and scientific care. And still, that death toll is 500,000 people. But once again, coming back to it, I think it will be sincerely dangerous for us to allow our children to be exposed because some children can come to school without vaccination and bring illness. We apply that standard to other vaccinations in the school system at this time, and I think COVID should not be an exception to it. And thank you for your patience with me. I feel, as a physician, I feel it is my duty not to allow an attitude that is anti-medical establishment or anti-vaccine to even subtle, even if it is subtle, to enter our society. I think we need to be grateful to medical science, the brave workers who have taken care of these patients, the healthcare workers, and put their lives at risk. The 70,000 people who volunteered to take vaccination, not knowing the results of it and not knowing if they were going to get a vaccination or they were going to get placebo. These brave souls made it possible for us to have the vaccination that we can use and be protected. And I think, again, coming back, I think our obligation to protect our children in our schools is very, very critical. And thank you, Mr. Chairman.
Okay, thank you.
Thank you.
I'd
Chairman
just
Halsey.
like the record to show that I love the medical community. My daughter is a nurse and my son-in-law is a doctor, so.
We have further questions. Dr. Terry, I think you want to speak again.
Thank you. Appreciate that. After the other folks have spoken, I did, and something that was that you brought up in your opening remarks. I do want to say that, University of Tennessee did make mention of making COVID vaccine mandatory, and I have received emails on that. And of course, that would come through us. So that is out there. But I want to address something that you said in your opening remarks that has gone on in this discussion. And it's, you said that we often can put health policy above individual liberty. And I kind of want to bring this back into terms of liberty with that, because I think a lot of people have a misnomer on that as it relates to health policy. And as we've had discussions with bills, including your bill, as it relates to individual liberties, and particularly as it relates to hospitals or any other facilities and liberties of people that work there. The term that I often use is egocentric liberty. When you think of your own liberty, I can shadow box over here all I want. But when I come in and I get close enough and I punch you in the nose, I'm infringing on your liberties. And so when we're talking about an individual's liberty not to be vaccinated, that's great. The question is the liberties of the other workers or the other students. And that's the issue at hand, how we want to protect all liberties and make sure that we have everybody protected to the best of their abilities that we can. What's different in this bill and the issue that I have with the current the COVID vaccine, it's under emergency use authorization. It's not fully FDA approved. And so to your point on your bill, if this does not pass, people could still mandate a non completely authorized FDA approved vaccine, which to me, you're infringing on those individual liberties, even those that are in a facility that may be excluded. So I just wanted to bring that out, like schools, you're talking about children. Your bill does not prevent someone from being screened, correct?
Correct.
Yeah. So if they're not mandated to have the vaccine, it's not even approved for kids.
Right.
So not even emergency authorized, hadn't been tested. But if someone ends up mandating that, and you want to opt out, you should be able to opt out, but you're not preventing them from screening, which then protects the individual liberties of the other kids. Correct? Mm-hmm. That's my point. That's why I support your bill as is. It protects liberties. Thank you.
Representative Freeman, you wanted to speak?
Yeah, thank you. And we spoke earlier about this, and I just want to make sure and repeat the question on the record. I've received calls from many of the hospitals, or many people from the hospitals in my district, and their concern, the language of this, force, require, coerce a person to receive the immunization or vaccine, is that it could be flipped around. And if they decide to incentivize somebody or don't allow someone who isn't vaccinated to work in a wing or in a shift that they've currently been operating in, that this bill would force the hospital maybe to do away with their policies. That they could put people that weren't vaccinated in an area where they could potentially expose vulnerable patients to potentially be exposed to the virus.
Yes, Chairman Holstein.
Thank you, Mr. Chairman. And you're exactly correct. The intent of this bill doesn't have anything to do with the reward system for folks that are encouraging it or how a hospital does all that. This is forced by government. It wouldn't affect that at all. It's not the intent of the bill.
Further comments or questions? And let me say, I would never debate the spiritual future or well-being of this nation, because whenever you sing, I see angels' wings flapping, and I certainly wouldn't debate the constitutional fortitude of this nation, because I think when George Washington was building one of his first platforms, you drove the last nail. However, I do think both of these bills are really short time decisions for a long time issue, and we failed to recognize that the origin of the COVID virus was a coronavirus, which has been studied since the 80s. And we have seen adaptations in certain places. And the reason that the Chinese were studying it for us, because after the Ebola situations that we had in Washington and the places they were doing those studies, they got into so much trouble that they wanted to farm out their research. So we didn't want anything to do with it. And so this is not a new situation. It's not a new situation. When I went to school, you couldn't get in school if you didn't have a TB patch test. And when I got married, you couldn't get married if you didn't have a venereal test. So, you know, this is not something that fell out of the sky. In the 1900s, early 1900s, the average lifespan of an American was between 42 and 44 years. And now it's in excess of 80, 85. And all statistics that so many of us love to account for, the statistics say that 75% of that is public health, not medical development. That it's public health that made those changes. So I feel like both of these bills are kind of a knee-jerk reaction to something, and you referred to statistics yourself, but statistics take a long time to form a hypothesis. So that being said, if there's no other questions or comments on this, what I'll do is introduce the amendment that we had. It's Amendment 3720, and I would ask for a motion and second on. Oh, I'm sorry. Pardon me. Oh, well, that's fine. Run away. Yeah.
Thank you. Since Chairman Ramsey is running the amendment, he's passed the gavel over to me. We have Amendment 3720. Okay, you have a motion and a second on the amendment. Chairman Ramsey, you're recognized.
Yeah, and this I need to ask you and establish the intent of this bill in relationship to our hospitals. The intent that you are insinuating is that you intend to prevent any government hospital from requiring COVID vaccination, even though medical and religious exemptions are always available by federal law to the employees. Am I correct in stating that?
Yeah, that's pretty accurate. The intent of the bill was to keep government force from occurring. It so happens that you have, 40 some odd hospitals that have government ties?
45.
45 hospitals, it turns out, have some form of government ties to them. So yes, this bill would end up affecting that. The purpose of the bill wasn't to stop hospitals from doing that. It was to stop government from doing it.
With that understanding, and one of those 45 hospitals is in my district, and we depend heavily on that. Let me say that hospitals typically are within the 4th or 5th highest employers in every community. So they're very essential to recruitment. They're essential to the economic engines of the community, and certainly they're essential to the public health. This bill's definition of government entity includes government-owned hospitals, which restrict those facilities across the state from requiring COVID-19 vaccinations if needed at some point, much like is frequently the case with flu vaccine. Now, I got to say, flu vaccine has never even exceeded 50% in compliance nationwide. And everybody finds that shocking. So you think everybody's getting it, but they're not. No hospitals at this time require mandatory COVID-19 vaccination for the employees But in order to protect the patients and ensure a safe environment, the requirements may be necessary because one of the issues with the beds, available beds, is that you have to take care of people that are sick with other issues, and so they have to keep some of the beds open. Healthcare workers are a priority of vaccinations for several reasons. They're at risk to exposure as a result of working on the front lines of the healthcare system, and healthcare workers are essential to the delivery as such, they need to remain as healthy as possible. Natural potential to unintentionally transmit the virus to patients during the delivery of care, as well as their families and communities, is a big issue. If the hospital employees were to be required to get vaccinated, the hospital vaccination policies would comply with federal law that requires exemptions due to medical and religious reasons. In such an event, the healthcare professional may be required to make alternative designations of wearing particular personal protective equipment or having additional steps to ensure the patient's safety. We have a representative of the Tennessee Hospital Association, which is the author of this amendment, and they are on our list from yesterday. If you want to have testimony and have questions about the amendment, or if you'd like to declare it a friendly amendment, that'd be great too.
Chairman Halsey, you recognize?
No, I'd like to argue against the amendment. But it's completely up to the chairman on testimony.
Do we have,
Yes,
I
we
mean,
have.
do we, from the committee, would the committee like to hear from, go out of session?
Yeah, I'd send-
Question on the amendment.
Question on the amendment.
Question's been called on, is there any objection to calling question on the amendment? Two objections? What's three objections? Okay. We have three objections to calling the question on the amendment. Okay. Would we like to go out of session?
Sure, I'd love to
Okay.
have
Without objection,
extra testimony.
go out of session and have the Tennessee Hospital Association testify. Oh, wherever you can turn on one of those mics. For the record, let us know your name and who you're with.
Sure. Thank you. Joe Birchfield, Tennessee Hospital Association. I would just echo many of the comments that Chairman Ramsey made earlier in terms of the importance of hospitals retaining their ability to require vaccine. As he stated, currently there are no hospitals in the state that are requiring COVID vaccine of their employees, but many hospitals do require flu vaccine of their employees for the reasons stated related to patient safety. As the COVID-19 pandemic persists and we still learn more, we know much more today than we did 12 months ago, even 6 months ago or 6 weeks ago. As this continues to evolve and the risk is undetermined, we want to make sure that all hospitals have the ability to appropriately manage their employees and ensure patient safety throughout the entire facility. And we believe that that should hold for a government-owned hospital the same as it does for a privately owned hospital. And as has been stated, the current bill before us would restrict that ability for government-owned facilities. The amendment that is before you would make it such that those facilities would be exempted from the bill without interfering with the other intents that the sponsor has stated.
Thank you. Any questions while we are, okay, Dr. Ramsey.
I'm understanding that this is a long-standing preparation in hospital administration. This is not something that's just developed since COVID showed up. You've had these guidelines, and this is something that you've had in probably the administration of the hospital for years.
That is the case.
And you see it as a risk that right now, as we've seen from the statistics that have been quoted, the death rate is remarkably low. But we know from other situations that have been in the last 100 years that can change almost overnight, especially with the transportation availability to citizens around the world. So if you'd like to make a comment on how dangerous you feel like not having that that option would be.
Sure. And if I could borrow from some of the comments that Dr. Kumar made previously about one of the reasons that we have seen the mortality rate be what it is with this is because we have taken so many different actions, from social distancing to the face covering I'm wearing right now, that has helped contain the spread of the disease. Vaccine is the ultimate way to contain the spread of that disease, and that is critically important for healthcare workers, not only for their own personal safety and the safety of their family and their community, and their ability to continue to come to work and care for patients who are either COVID positive or other patients in the facility, but most importantly, to protect the safety of vulnerable people in our facilities.
Any other further questions while we are out? Okay. I do have some questions for you before we go back into session. So if this amendment goes on, currently, we're in a pandemic, and as it is right now, you could mandate a vaccine immunization, correct?
Correct.
But none are doing that, correct?
But not at this time. That is correct.
So you could mandate an emergency use only, but a non-complete FDA-approved vaccine right now if this amendment goes on.
That if this amendment goes, yeah, absolutely.
Okay. So we have something that's not completely FDA approved, and you're saying that the rights of the individuals that you employ or that are employed, you can force that on them.
It's not a matter of forcing it. Is we can require an employee to be vaccinated, much like we do with the flu, and I think that's the most relatable example. And if that employee has a medical reason or a religious exemption, federal law requires us to allow that and make accommodations for that employee so they can continue to function in their capacity.
But it is in a pandemic, though, that's removed.
That is not my understanding. That I don't believe that the status of a pandemic, I'm not aware of that having an effect one way or another on the requirements that we place. Our concern with this legislation is that going forward, because while the pandemic may be over, hopefully in the near future, COVID-19 as a disease or illness does not appear to be going away, which is why vaccination is critical. And as we continue to learn more about that, as this could continue to evolve and change. And I think 12 months ago, as we sit here today, none of us would have imagined the events of the last year playing out as they have. And so to tie or restrict the hands of a subgroup of hospitals whose top priority is to care for their communities and patients and ensure safety and well-being for all, we think that rises to the level of trying to fix this legislation to allow a government-owned hospital, and as has been stated, there are 40 some odd of those facilities in the state, to be able to make those judgments as they see fit for the betterment of their community and their employees.
All right. Thank you. All right. Without further questions, without objection, we will go back into session. Thank you.
Thank you, Chairman.
Okay. We are back in session. Chairman Halsey, you're recognized.
Thank you. I got to tell you about the amendment. I hope you don't put it on there, and let me tell you why. If you put the amendment on this bill, you make a hypocrite out of me. You force me to talk out of both sides of my mouth. Out of one side of my mouth, I say government can't use force to force somebody to take a COVID-19 vaccine. But out of the other side of my mouth, I say, except hospitals, and they can force you to take COVID-19 vaccine. So it makes me duplistic. If my bill sits on righteous constitutional ground, then the amendment takes that righteousness away, and you can't get sweet water and bitter water out of the same spring. So I would rather you killed my bill than to make me duplistic.
Thank you. Chairman Kumar, you're recognized.
Thank you, Mr. Chair. I think I would like to make a remark that it's really not forcing people, it's requiring people. And there is a lot of difference between forcing people or requiring people to take a vaccination so that they are not a hazard to the other hospital employees and to the patients. So there is a difference. My other question is that does this amendment cover the nursing homes?
That'd be a question for. Recognize Matt King with Legal Services.
Chairman Kumar, the question I believe is, would this cover nursing homes? The way that it speaks in the amendment, subsection B states that the prohibition that is in subsection A, and subsection A is essentially Chairman Halsey's original bill language. The addition of subsection B says that subsection A does not apply to a healthcare facility. Healthcare facility is defined in there as an institution, place, or building that provides healthcare services and is required to be licensed under the bill, which is Title 68 or Title 33.
So coming back to the question, does it cover nursing homes?
It would, yes.
I hear some people shaking their head no. You think that it will cover
Chairman Kumar, you're recognized.
nursing homes?
Matt
Nursing
King,
home-
you recognize.
Sorry, Chairman. The nursing home would fall under that definition of facility.
Okay, thank you.
Representative Hall, you recognize.
Thank you, Mr. Chairman. Thank you, sponsor, for bringing this bill. I know that you've done a lot of work to it, and I appreciate you bringing it forward. I'm against the amendment for one simple reason. It compromises the integrity of the whole bill. This bill is more about vaccines and is about freedom. It says that, hey, I need to make my decisions for my life when I want to make it, at the time I want to make it, for me and my children and my family. It's a shame that we even have to have a bill that discloses that to back up the heavy-handed government and the overreach of government that infringes upon our lives. It should be a personal choice. And if there's no danger in the government forcing vaccines, well, then let's all vote in affirmative of this and go. Mr. Chairman, that's all I've got. Thank you, sir.
Thank you. Any further questions on the amendment? Representative Freeman, you recognize.
Thank you. You know, I keep hearing a lot about freedom and in regards to this vaccine, and the government's going to force someone to get a vaccine. And if you work at a hospital and you're forced to get a vaccine, if the hospital employee decides they don't want to work in the hospital anymore because the decision of not getting vaccine is more important to them, where is the freedom of that business to make a decision of how they employ their doctors? Does that person have the freedom to go practice medicine at the hospital without a medical degree? The hospital has a right to set parameters in which they want to operate. And so this idea of this forcing, you know, people have a right. If you don't want to go somewhere because you can't get vaccinated, that's fine. I don't shop at businesses because I disagree with something that they do, and I shop at other places because I like them. We've set up almost a false argument here about this freedom to me. And I support the vaccine because I think at a bare minimum, we need to be able to protect hospitals, but I'm still not in favor of this.
Chairman Halsey, you recognize.
I have no comment. Thank you.
Any further questions while we're on the amendment? Okay, seeing none, we are voting on amendment 003720. All those in favor say aye. Aye. Opposed? No. Ayes have it. The amendment goes on the bill. I relinquish the gavel back to Chairman.
Hey, you're still here. Any other questions or comments on the bill as amended? Dr. Kumar, you're recognized.
Thank you, Mr. Chairman. Thank you, really, Chairman Halsey. Again, we have great respect for your views about liberty and defense of liberty, and we'll stand together shoulder to shoulder to defend liberty. But certainly, I think the most important thing we must realize is that we cannot afford to expose one more child to possibility of COVID. You said the mortality is low, but the mortality is there. And we should not and we could not take a chance on one precious life of a child. Thank you, Mr. Chairman.
Chairman Smith.
I just want to thank the sponsor again. You wrote a very good bill. This still is a good bill because it protects the liberty of Tennesseans. And you have stated over and over again that the legislative intent of this bill is not to mandate or force use of force by government. So I want to thank you for being very deliberate in writing this. One of the things that we have fallen into is accepting the premise that we have to abdicate our religious liberty, our freedom to have public health, to have commerce, to have prosperity. And then here in Tennessee, deliberate kindly and respectfully, and put the priority of Tennesseans to have liberty, to have public health, and to have our prosperity all together. So I want to thank you, and I will be voting for the bill. Thank you, Speaker.
Thank you.
Further comments or questions? We have any objections to calling for the question? If not, we will be voting on the bill as amended. All those in favor say aye. Aye. All those opposed? No. The ayes have it.
Thank you, Mr. Chairman of the committee.
Anybody call? And the I had a question from the sponsor on that. Once a bill goes into a committee and is moved and seconded, it's the property of the committee. So the committee can do anything they want to with it if they want to add an amendment that's hostile or whatever. But the amendment has to be added back on in the full committee. So just wanted to make that clarification in case you go into a committee and somebody wants to put something on there you don't like. That's the way it works. That's the way parliamentary procedure goes. So any other questions, comments? If not, thank you all for being here, and we will adjourn.